My name is Ryan Bessemer, and I'm the Director of Growth for Strada Healthcare. I'm going to take a few minutes today to explain what direct primary care is and how our services fit in with your health insurance benefits through the state of Nebraska. Before I jump into direct primary care, I want you to think about your car insurance and how you use it day to day. Your car insurance is there to protect you if something catastrophic happens to your car, like a bad wreck or hail damage. But for all your routine maintenance on your vehicle, such as oil changes or tire rotations, you would never think about using your car insurance. Instead, you'd pay separately for those services and reserve your insurance for the big things, and probably hope that you would never have to use your car insurance. This view of car insurance is how health insurance is viewed with direct primary care. Hopefully, you won't ever have to use it, but it's there if something more catastrophic happens. This is how it works. Direct primary care works best when paired with a high-deductible insurance plan. Your insurance will be your safety net for unexpected care like emergency room visits or hospital stays. Your primary care needs like annual physicals and checkups should be met by your direct primary care provider. While insurance isn't included in every single health transaction, that means you don't have to work with copays or your primary care provider doesn't have to fill out a bunch of paperwork just to bill your insurance company. This can make healthcare easier for you and allow access for your primary care provider to spend more time with you. This is the mission of Strada Healthcare and the growing movement of direct primary care doctors around the country. To put it simply, direct primary care is membership-based healthcare that gives you unlimited access to your primary care provider, whether you visit them in office or virtually. You will never have a copay or an office charge for using Strada Healthcare, and you can visit your primary care provider as often as you need to. As a state of Nebraska employee, you have access to direct primary care as part of your health benefits, and you can join by electing the standard or select direct primary care health plan. We commonly get asked by patients, will Strada Healthcare work for me and for my family's care? Well, it could. So here are some examples. If you're independent and you'd like to focus on preventative care, or if you have family that's young, healthy, and busy, or if you're older and need more access and after-hours communications with your primary care physician to manage a chronic condition or potentially avoid unnecessary trips to the emergency room or the urgent care. This is the list of care that's provided in your direct primary care membership. This can help clarify if Strada Healthcare is right for you. I want to reemphasize that you can use the Strada Healthcare Clinic as often as you need to and never worry about copays or office visit charges. Annual physicals and annual lab work, preventative appointments and follow-ups, repair of simple cuts and abrasions, treatment of sprains, women's health excluding labs and mammograms, well checks for children and infants excluding immunizations, chronic disease management, weight management and health risk assessment, work, school, and sports physicals, basic mental health, and stress management. So if you're expecting to have a child soon, or if you or one of your dependents are undergoing cancer treatments or surgeries, or if you go to the ER often, keep in mind that Strada Healthcare won't cover those because they're not part of the primary care services. For that, you'll need to rely on your high deductible insurance plan and meet that deductible for full coverage to kick in. That being said, the goal with direct primary care is that we'll be able to handle the majority of all the health care that you need in a given year. In fact, on average, primary care providers are actually able to take care of upwards of 90% of a person's healthcare needs. And better yet, in the direct primary care environment, your providers will spend as much time as you need with them in order to meet your healthcare needs. If you need to be referred to a specialist, they can absolutely do that as well. But many direct primary care providers end up finding themselves visiting with their Strada healthcare provider for conditions that they were previously seeing a specialist for. And if you need it, we also have discounted cash prices with a number of specialists and other lab tests that you may need. Again, with Strada Healthcare and direct primary care, you get unlimited access to the clinic for your office visits or virtual communication. You'll have the ability to access your Strada provider when you need them, and any care you receive with them is covered as part of your direct primary care membership. If you can avoid one unnecessary trip to the emergency room or urgent care with this kind of access, your direct primary care membership could end up saving you quite a bit of money. On the other hand, we hope that you'll have access to the clinics as often as you need to and focus on preventative health care. This will not only help you live a better lifestyle in the future, but we hope it will help you avoid unnecessary medical conditions as you age. In terms of access to your primary care provider, here's how it works. Strada Healthcare uses a secure communication app called Spruce, which allows you to communicate directly with your provider. Throughout COVID-19, I'm sure many of you got to try out virtual care for the first time. There are many different apps and services out there that exist in the realm of telemedicine. The difference with Strada Healthcare is that you'll be communicating with your provider, and there's a huge benefit to talking with someone you know. We think that telemedicine is much more valuable when it's built upon a good relationship between a doctor and a patient. Here are some of the most common reasons that direct primary care members will use Spruce: for sinus infections, cold, flu, fever, rash, abdominal pain, pink eye, ear infection, migraines, or sore throat. By electing the standard or select direct primary care plan and joining Strada Healthcare, you will automatically be given access to Spruce and can even use it to set up your first appointment with your Strada Healthcare provider. We commonly get asked, what's the difference between a direct primary care provider and a primary care provider if you'll be required to switch your doctor if you join direct primary care? A primary care provider who is not in direct primary care will help you with all your primary care needs. However, if they're not a direct primary care provider, they will bill your insurance, meaning that your visits and all costs associated will go towards your deductible. Once the deductible is met, a percentage will have to be paid. A direct primary care provider will also help you with all your primary care needs, but will not bill your insurance or charge you a copay when you visit. Both types of physicians have to decide what type of model of primary care and billing options work for them and their patients. Because not all primary care providers choose to be direct primary care providers, Strada Healthcare can only provide its benefits through our direct primary care providers. You are not required to switch from your primary care provider that you may see today to a Strada Healthcare direct primary care provider. However, you will need to use a Strada direct primary care provider to utilize the unlimited access to primary care. Strada has locations across the state of Nebraska. Currently, our clinics are located throughout the Omaha Metro, Gretna, Lincoln, Norfolk, Grand Island, Kearney, North Platte, and Scottsbluff. When you join Strada, you'll be asked to pick a clinic to serve as your direct primary care clinic. Most people choose a clinic and provider that's closest to where they live or work. You also do not have to live in one of these cities to join Strada Healthcare, and many of our members that live in more remote cities find incredible value in using Spruce, the telemedicine app, for their everyday questions or prescription refills, and will make a drive to the clinic for any scheduled appointments or blood draws. I mentioned earlier that you can join direct primary care as part of your state of Nebraska health benefits. In order to do this, you need to elect to participate in either the select or standard high deductible health plans that include direct primary care. The total cost of the health plan and direct primary care memberships is in red on this chart. I want to take just a minute to mention on this slide that if you are electing coverage for a family, direct primary care is a great solution for children. It's far easier for parents to use Spruce, the telemedicine app, to get care for sick children rather than having to take them away from work and school to bring them into a typical physician's office. If you're busy and on the go with kids all the time, I think you'll find that direct primary care could save you a lot of hassle. I think it's important to point out that direct primary care is included with the two health insurance plan options with the lowest premium to you. If you do not have healthcare claims, then direct primary care is the lowest cost option available to you. If you do choose the direct primary care plan and you make insurance and pharmacy claims, please keep in mind that the deductible on your high deductible United Healthcare insurance plans would need to be paid before the health plan will pay the portion of your claims. If you want to learn more about direct primary care or have questions about how joining could benefit you or your family, here are some resources for you. First, visit our website for state employees at www.stradahealthcare.com/Nebraska. There are answers to frequent questions, summary of benefits, and links to a few videos that are very helpful. Secondly and finally, you can always call us or email us with questions. We can be reached during normal business hours at 402-401-4404, or you can email info@stradahealthcare.com. Thank you for taking time to learn about direct primary care. I hope you will consider joining us this year. If you have any questions, please don't hesitate to reach out to us. Thank you.